Through, let's talk to our health correspondent, Anna Collinson, and we've had an update in terms of where the nation is now, Anna.
Yeah, just in the last few minutes, the death toll has been announced, and it's an increase from yesterday by 181. So the death toll for the UK is now 759. Yesterday, it was 578. And yesterday, when that figure was announced, it had gone up by 100. And because there had been a change in how the government were recording this data, that seemed to explain that big increase. But again, today, we're seeing an increase by 121. What we had heard in the PM's press briefing yesterday afternoon from the Deputy Chief Medical Officer, she had said that the figures that they had received, looking at the trend, there had been a slight glimmer of hope that the UK's trajectory compared to other countries wasn't as steep, and they were hoping that things were looking more positive. Obviously, these figures will need to be looked at, but it does appear to be bigger than what people might have been expecting.
Yes, and continually we have to look at other countries, and we will continue to do that here, of course. This all coming on the day that we've learnt about the Prime Minister and the Health Secretary. There could now be, one imagines, an awful lot of people in political circles who have to think very carefully about what they do.
Yeah, exactly. Boris Johnson announced this morning that he had had some symptoms that are associated with coronavirus, so a temperature, a cough. He was tested by NHS staff at Downing Street, and that test came back positive. Shortly after, Matt Hancock revealed he had also been tested and was positive. And that means that they both need to now go into self-isolation, abide by the rules that the government had set them. So self-isolation in Downing Street means he's not allowed to go outside unless it's for a short period of exercise. He can't go out shopping for food or for medication. He can't see his friends or his family. He can't have visitors. And again, it'll be the same for Matt Hancock. And the type of symptoms that Boris Johnson can expect is the sort of common symptoms that people have. The majority is this persistent cough, this high fever, in some cases pneumonia. There are, for the minority, more serious symptoms like difficulties breathing, needing to rely on a ventilator. But as I say, it is a minority, and it does tend to be for elderly people.
And a thought about the coming weekend, because we've been reflecting that some hospital officials, some health officials are saying we really have to watch these figures over the next weekend. We're so worried about a potential spike. I'm trying not to use all the words that aren't necessarily very helpful, but you will appreciate what I mean by that. And there's a lot of talk, for example, on particular pressure on hospitals on the outskirts of the capital. How can we explain that?
Yeah, I mean, the next 2 to 3 weeks, experts are saying that's when they think it will be the peak. I know we've started the lockdown now, but sometimes it takes symptoms up to 2 weeks to appear. So the next 2 to 3 weeks is going to be really hard for hospitals. That's what experts are saying. And the entire UK is affected. We've seen hospitals in Glasgow and Newport warning about it. But in London, that is where a third of the cases are. And a senior NHS boss has warned there could be a tsunami of cases this weekend, that critical care support might not be available. And so we've been hearing that NHS staff from other parts of the UK, other parts of England, are being drafted into London to try and help and do their bit. And of course, there are the problems with what's going on with hospitals at the moment. Not enough equipment to go around, even though the government is trying to get it out onto the front line. But also the fact that testing, lots of staff are having to take time off work because they've either got symptoms or someone they're living with has symptoms and they can't go in.
Yes. All right, Anna, for now, thank you very much. Our health correspondent, Anna Collinson, thank you.